Hello and welcome as we continue to report from the front lines on the coronavirus case. Now, the number of positive cases in India is touching 19,000. We're at about 18,600 cases right now, and about 590 people have died. However, there are some other trends now which are clearly emerging. There are some states, Maharashtra, Gujarat, Rajasthan, Madhya Pradesh, and two cities, of which one is a state, that's Mumbai and Delhi, which are clearly showing far higher numbers than the rest of the country. We are also on the 21st of April, on the 20th of April, the lockdown was partially lifted, and some industries, for instance, have been allowed to resume work at a much lower percentage of attendance, obviously. And May 3rd is the date that we are currently looking at for a lifting of the lockdown, if that indeed happens. Now, the question is, what is our current hospital system loaded at, and how positioned or well positioned is it to see any potential surge in cases across the country? To discuss that, I'm joined by Dr. Girdhar Gyani, Director General of the Association of Healthcare Providers of India, which represents over 2,500 bed plus hospitals, as well as another 10,000 hospitals and clinics across the country. Mr. Gyani, thank you very much for joining us. So tell us, the last I spoke to you was the 6th of April, where we spoke about what the load levels were. At that time, of course, you were saying that most hospitals were only functioning at about 30% because they had been vacated, in a manner of speaking, to accommodate any potential increase in COVID cases. So where are we today?
Now, there is a major shift happened on 20th April. 20th April, as per the Government of India order, all hospitals can resume the normal functioning. That means, in a way, they can even take up the certain elective surgeries which have been waiting for a long. In fact, few state governments have gone one step ahead. For example, Bihar issued the order that all hospitals must start functioning. If they do not do that, then penal action will be taken against them. More or less similar case has happened with Rajasthan, Punjab, and Chhattisgarh, to name few. Now, this issue here is, now we want to see that all private hospitals should start functioning in a normal way. There are two reasons for that. One, they should take care of the patient who have been waiting for a long time due to the lockdown and the government instruction not to take elective surgery. Number two, now the time is so that in case the load surge, then we are going to utilize these private hospitals also for the COVID cases. One more I'll add here, that let us say case of West Bengal, that here if the patient is coming to a private hospital, which is non-COVID hospital, and if the patient reports symptomatic after 2 days or 3 days, the instructions are, do not transfer the patient to the COVID hospital. Instead, treat them in the same hospital with the precautions, putting them in the isolation room. Now, for this to happen, the problem which our member hospitals are going to face or are already facing is, that means they will be taking all the patients from now onwards as a COVID suspect. And necessary PPEs and the level of preparedness in the OTs and other places will be done as per the keeping in view that patient is COVID. So this, what is happening is, the cost of treatment easily will go up by 25 to 30%. Just because of the PPEs, extra fumigation, extra things like that.
Okay, so you're saying now every patient in this country who walks into a hospital will be treated as a COVID patient. Did I get that right?
Absolutely, that is right, you are saying. And,
okay.
And let me also tell you, particularly if you are going to do a surgery, then the practice will be that we will undertake the rapid test on the patient. Preferably, we'll tell him that 1 day before the admission, get the test done from the exercise center. This is what actually is the common ground which hospitals will be following.
Right. Okay. So I'll come back to that in a moment. But we've also had cases, at least in Mumbai, for instance, and some other places, that patients have been turned away by hospitals because they were not COVID positive. And in a couple of cases, they've died as well. So is that something that will not happen now?
Yeah, because few state governments have actually very explicitly issued the order that you will not turn away the patient. In fact, if you remember, right in the beginning also, central government had issued the order right in the beginning that the patient coming to private hospital, if he is found to be COVID, don't send him to the government because 2 people died that time. So, but this is now becoming explicitly in the orders of the state government, more so when all hospitals from 20th April onwards have been asked to start the normal operations.
Okay, now tell us about what the load is looking like, Mr. Gyani, particularly in these 3 or 4 states, Maharashtra, Gujarat, Rajasthan, Delhi.
You see, luckily for us, these 3 places which you are mentioning, for example, in Jaipur, there 3 major hospitals have been identified which are having a bed capacity of 1,500 each. So total 6,000 beds are available in Jaipur alone for the COVID patient, which include 2 government hospitals and 1 private medical college hospital. Similarly, in Delhi, I have been telling you earlier also that we have catered for 3,000 beds in the city of Delhi. In fact, the majority of them are with the ICU beds. So again, here also no problem. Mumbai also no problem because we have a lot of hospitals there which are under the municipal corporation. So I will say, luckily, the places where more cases are happening, we have the capacity. Our worry is that this should not happen in the smaller cities where we may run into problem.
Right. No, but you also said that hospitals have resumed non-COVID treatments and elective surgeries, right? So, given that now all kinds of patients are now going to come back to this thing, so what is the likely outcome going to be?
Yeah. So the only way it will be that the hospital which are going to take mixed of the load. Okay, you see, let me tell you now there is, by the way, there is one guideline issued by the central government day before yesterday, that how do you take care of the patient in this circumstances. This is a 4-page document, and which says that in case suppose a patient becomes the COVID, how do you isolate that floor? How do you isolate that section? Or how do you keep your doctors and nurses only for 6 hours duty? All these instructions have been issued now. With that, I think hospitals will be in the better position to take care of this situation.
Right, and the figure that you had given when we last spoke was about 2.2 lakh ICU beds across the country, 220,000 ICU beds. I don't know if that figure is something that you're still standing by. And you had also said that roughly half have ventilators, or we have half of. Yeah. Now, do you have a sense of how many ventilators are being used? How are we doing in terms of oxygen supply, particularly in some of these states now where we clearly have more cases?
You see, our now experience has been that most of the cases, oxygen supply is doing a good job. It is working very well. We should not be rushing patients straight to the ventilator. This is what actually we have learned in the past few cases, In fact, some people were saying that person who is going on ventilator, the survival is very less, The 80% people are dying. Now, but actually that is not the fault of ventilator. That is because we push the patient to the ventilator only when we find the lungs are absolutely not pumping, So that in any case is the worst case. But what I'm saying, if the better utilization of the oxygen supply, most of the patients are recovering and responding better. But as I told you that 50,000 ventilators were there already, 40,000 has been added now. So I think immediately we do not see much of the problem because the number of cases going for the ventilators is hardly going to be 4% of the total infected.
Right, at this point. And when you look at the numbers, I know it's slowing down, but when you look at the numbers of positives that are being added, any concern for the next couple of weeks?
Yeah, actually we are watching, that when are we reaching the peak? For example, yesterday 1,300 cases got added up. We were actually hovering around 900, 800, 1,000, around that. Now yesterday 1,300. So actually that proves that the extension of lockdown was justified. That means the authority or government was right to predict that let us have more period of lockdown so that we actually get the estimate what are the number of the people who are going to come. Once we reach the peak, the way it has reached in some of the other countries, and it starts then slowing down. But other good factor is that doubling of at the national level is 8 days now.
Yeah.
So anything more than 7 is good for us. And some of the states, Kerala has shown the exemplary example. Only 3 deaths, which actually had the largest number of the cases at one point of time. So I think with kind of precaution, strict lockdown which was followed in Kerala, I think the Kerala is a state where a lot of literacy is there, discipline is there. I think they have been able to show the example for rest of the states.
Right. Mr. Gyani, thank you so much for joining us and giving us an update on where we stand today. I hope to connect with you in coming weeks to see where we stand then. Thank you so much.
Thank you.